Content in this video should not be construed as medical advice. It is for information purposes only. Please consult your physician with any health concerns or questions.
Good morning. I'm Dr. Larry Goldstein with the Women's Clinic. Today I'd like to talk about osteoporosis. Osteoporosis is a disease in which the bone mass becomes lessened. The significance of this is that it increases the risk of what is considered fragile fractures. That is, a fracture that occurs just falling from a standing position or very little trauma. Women are much more at risk for developing osteoporosis than men. At the age of 40, women start losing bone mass, and calcium is very important to begin at this point. There are 4 major risk factors for developing osteoporosis. Number 1, if there's a family history of osteoporosis, which means a vertebral or a hip fracture, then that patient is at a higher risk. Number 2, if she has had a previous fracture of the spine or hip, then that puts her at a greater risk for another fracture. Number 3, smoking has a very detrimental effect on the bones. And number 4, weight less than 127 pounds, and that's just statistically shows a greater risk. There are other causes. Certain medications cause decrease in calcium uptake, certain GI diseases that affect absorption, and certain endocrine disorders such as parathyroidism or hyperparathyroidism. Prevention is the best treatment. Prevention would consist of daily calcium intake split between dietary and calcium tablets plus vitamin D. The recommended amount of calcium is 1,200 milligrams daily, and vitamin D is 800 to 1,000 international units daily. There are other treatments once a person develops osteoporosis. Of course, estrogen is protective of the bones, but doesn't necessarily treat osteoporosis. There are several other medications, a class called bisphosphonates, that help decrease the reabsorption of the bone. There are serums, which are selective estrogen modulator receptors that have the same effect as estrogen except without the potential side effects. And then there's parathyroid hormone. Lifestyle changes are very important, of course. Stop smoking, limited alcohol intake, and exercise is a very important part of helping prevent and to help treat osteoporosis. Weight-bearing exercises and muscle-building exercises are very important. At 50, we do recommend a bone density screening test, and not necessarily treatment at that time other than counseling as far as lifestyle, calcium intake. And there are probably 1.5 million osteoporosis fractures in this country every year, and that's a very significant number. The morbidity that goes along with fractures, especially hip fractures in elderly people, has approximately a 20% mortality rate. So it's very important that these people are caught early, treated.
If you would like to discuss this or any concerns, please contact your physician at the Women's Clinic at 601-354-0869.